Hi, this is Doug. I'm going to discuss the first two parts right off. Why is someone in Africa more likely to have HIV/AIDS than a person in the United States? How are we affected by the geographic origin in which were born? And does social class and socioeconomic status affect the likelihood of someone contracting HIV? In our Classroom TED Talks video, Flip Your Thinking on AIDS in Africa, it was stated that AIDS is a disease linked with poverty, which Africa has an abundance of. Differing areas are going to have different disparities related to poverty and socioeconomic status, and also what policies and programs they have in place and implemented to decrease the spread of HIV. In the video, it was discussed that life expectancy in Africa in many places was around 40 to 50 years, and people living in an area with a shorter life expectancy are less likely to decrease sexual encounters, even in response to the higher risk of a sexually transmitted disease such as HIV. Causes for decreased life expectancy rates were discussed, including malaria. It was shown people were less likely to decrease sexual encounters in areas that have a greater incidence of malaria, where life expectancy is expected to be shorter, in comparison to areas of fewer incidents of malaria, where life expectancy is longer. So what is learned is that when you fight other causes, such as the shortened life expectancy, there is also a great effect on the decrease in sexual encounters, thought to be an investment in living longer and better, which in turn decreases the spread of HIV. A decrease in the spread of malaria has a much greater impact on changing human behavior to prevent the spread of HIV than expensive education campaigns. Now in the third part, we'll find one program that has been implemented to help stop the spread of HIV, explain the program and why it has or has not been successful. Searching on the website for the Centers for Disease Control and Prevention, I found the United States uses the National HIV/AIDS Strategy, in which they call High Impact HIV Prevention. They found, as in the Classroom TED Talks video, that there are certain demographic populations at higher risk of HIV transmission. And when we go after those areas of demographics, then it decreases the spread of HIV. The program addresses populations where disparities of risk are higher, including gay and bisexual men of all races and ethnicities, which is the hardest hit group and also remains so. Men who have sex with men represent 2% of the U.S. population, but account for 61% of all new HIV infections as of 2009. The hardest hit ethnic population were the African Americans, who represent 14% of U.S. population and account for 44% of new HIV infections in 2009. The rates of infection in Latinos are also a bit high. They represent approximately 16% of the total U.S. population and account for 20% of all new HIV infections in 2009. Injection drug users represent 9% of the population and 48% of new infections in 2009. In 2008, 28% of male to female transgender individuals tested positive for HIV. As stated before, the number of new infections continues to go down, but each year the new infections are combined with the total number of people already infected. The exciting part is the number of new infections are continuing to go down, although we do have an increase in the total number of infected people. With treatment, they're living longer. This demonstrates proof of the program's effectiveness, even against an uphill battle, because the more people infected creates a greater number of chances of transmission, but the number is getting less. Other successes are a dramatic decline in mother-to-child HIV transmission and reduction in new infections among injection drug users and heterosexuals over time. The estimated cost of providing care over the life of an HIV patient is estimated to be $360,000, and there's been an estimated 350,000 averted transmissions of HIV due to prevention efforts. So what are some of the prevention efforts going on? Right now we're looking at antiviral therapy. When people are treated early on in their infection, they're less likely to transmit the HIV virus. And also their testing And linkage to care program, when someone knows they have HIV, they get the care they need that helps them find ways to prevent transmission to others. And also they have confidential identification and letting people know, letting their partners know who may have been unknowingly exposed to HIV, and keeping that confidential. And people are more inclined to be cooperative with that program. That helps decrease the spread of HIV. Other things they're doing, others are substance abuse treatment and screening and treating of sexually transmitted infections. And so far, so good. The program has been effective in decreasing the spread of HIV. Thanks.